Do you think that the Senate is going to be able to get Mitch McConnell, your senator from Kentucky, one of, that he's going to be able to get away with actually ramming this thing through in the cover of darkness?
Let me give you my theory on what's going on.
Okay.
And you have never heard this before.
This is the Yarmuth theory.
You've never heard this before.
Exclusive here on the Bill Press Show. Go. Wait, we have a little breaking news. Jamie, we need the breaking news sounder. No, do we have? Yeah, here we go.
This is a Bill Press Show breaking news update.
All right, you're on.
And this is not coming from Mitch McConnell. I think Mitch wants it to fail.
Whoa.
I think that the reason he's kept it secret up until now is because he doesn't want a lot of public discussion, because he knows that whatever comes out of the Senate is going to have 20% approval rating, just like the House bill. He doesn't want to hang that on his members. He knows it can't pass, probably won't pass the House when it comes back anyway. So keeps it secret, rushes it to the floor. It goes down. Nobody ever pays attention to it again. So his members will say they got to vote to repeal, quote unquote, the Affordable Care Act, and there are no repercussions because nobody ever really focused on what was in it. That, knowing Mitch for a long time as I have, the one thing he's going to be concerned about is protecting his majority. That's number one. It's not going to be improving the health care situation. And, of course, that's true of all the Republicans. They don't care about health.
Right.
This has never been about health. This is about politics, and it's about tax cuts.
So if what you say is true, Congressman, then that the situation would be the House has passed its bill, which went over to the Senate. The Senate does nothing. Repeal is dead.
Repeal's dead.
And what happens?
But everybody got a chance to vote on it.
Everybody got a chance to vote, right? And then what happens to Obamacare?
There's going to be very significant pressure on everybody to fix the problems in the individual insurance market, and that's where the problems exist.
Yeah.
You know,
that should have been the focus in the first place.
Exactly.
We're building up to.
The ACA is working fine by and large, with the exception of this narrow segment of the insurance market, the individual market, that's basically about 6 million people in the country out of 300 million people. So it's 2% are affected by it, but those people are affected dramatically. There's some real impacts on them, some more than others. But and this is why what's interesting to me is when the House bill came out, the way they approached kind of the high users, the expensive patients, was to create a high-risk pool, government-financed high-risk pool. And I tweeted out after they passed it, I said, do the Republicans realize they just voted for a public option? Because they did. They can call it whatever they want.
Yeah,
they can call it a high-risk pool, but it's a public option financed by public dollars. So the answer ultimately in the individual insurance market is some kind of government option, whether it's let them buy into Medicare, which I think is the easiest way to do it. And I've had conversations with Republicans. When you actually talk them through it, they get that. Now, they don't want to admit that that's a public option, but the only way to do it, when you have like this person in Iowa whose insurance is his coverage, his health care costs $1 million a month, that's somebody clearly who distorts every individual insurance market. And I've talked to insurance executives, Humana's based in my district, and who've said to me, the only way the individual insurance market is sustainable is if the government does it. And that's what will end up. We may call it something different than a public option, and if it's a Republican-controlled Congress that does it, we will call it something different. But it'll be the same thing.
Right. Public plan option.